If you've just been diagnosed with triple-negative breast cancer, you might be feeling scared. If you've had a look online, there are some terrifying facts out there. You might have read that it's the worst breast cancer to have, it's more likely to spread, and it's harder to treat. You might be wondering why triple-negative breast cancer isn't mentioned more in the latest research and studies. You'll almost certainly want to know what the latest treatments are so you feel like you're in control. Today, I'm going to gently walk you through everything you need to know about triple-negative breast cancer, and you should feel empowered when you get to the end. I'm Dr. Liz O'Riordan. I'm a breast surgeon who's had breast cancer, and I do the research so you don't have to. Make sure you hit the subscribe button so you don't miss my next video. So what is triple-negative breast cancer? Well, it's a type of breast cancer that doesn't have receptors for estrogen, progesterone or HER2 on its surface, and this means that the only treatment available after surgery and radiotherapy to reduce the risk of it coming back in the future is chemotherapy. Hormone-blocking treatments like tamoxifen and targeted anti-HER2 drugs like Herceptin just won't work. How common is it? Well, it's actually relatively rare. About 12 to 17% of all breast cancers are triple negative, and most triple negative breast cancers are invasive ductal cancers. Only 1 to 2% of all triple negative cancers are lobular. When was triple negative breast cancer discovered? Well, this didn't actually exist until 2005, and that's because HER2 receptors weren't linked to breast cancer until that time. And that's why a lot of breast cancer trials don't mention it, simply because it didn't exist when the trials began. Are all triple-negative breast cancers the same? I was surprised to learn that they're not. Triple-negative breast cancers can vary widely with genetic, histological and clinical differences in how they behave. Now, this might be a bit scary to hear. Most triple-negative breast cancers are fast-growing, high-grade tumours. They do have a higher risk of recurrence within the first 5 years after your diagnosis when compared to ER-positive cancers. However, there are some triple-negative cancers that are low-grade and slow-growing with a much better prognosis. Who gets triple-negative breast cancer? Although anyone can get it, it is more common in these 3 groups of people: Hispanic and African American women, young women, particularly those who are premenopausal, and anyone with a BRCA mutation. How is triple-negative breast cancer treated? Well, your surgery will be the same as any other breast cancer of a similar size and grade. You might need radiotherapy depending on the type of surgery you had. What is different to ER-positive cancers is that everyone with a triple-negative breast cancer is offered chemotherapy to reduce the risk of it coming back in the future. And this is nearly always given before surgery, and that's called neoadjuvant chemotherapy. Why do we give chemotherapy first? Well, this helps your team monitor how your cancer is responding to the drugs. You'll get regular scans during chemo, and if your cancer disappears completely, so there is nothing to find when they look at your breast tissue under the microscope after your operation, this is called a pathologic complete response, or a PCR, and it means you have a better prognosis than someone whose cancer doesn't shrink. And out of all the breast cancers, triple negatives have the highest rates of a PCR. Around 35 to 50% of patients see their cancer completely melt away. What chemotherapy drugs do you get? The standard regime is to give an anthracycline, like doxorubicin, and a taxane, like paclitaxel, together with a platinum-based drug called carboplatin. There have been 2 randomised trials, the CALGB 40603 and the GEPAR 60, and they showed that adding carboplatin increased the number of women who had a complete pathological response after chemotherapy. If you have a high risk of recurrence, you may also be offered pembrolizumab, also known as Keytruda, and this is a type of immunotherapy. What about olaparib? If you have a BRCA mutation, you'll be given olaparib, also known as Lynparza. It's a targeted cancer drug that blocks PARP enzymes. They repair damaged DNA in cancer cells. And if a cell doesn't have a healthy BRCA gene, blocking the PARP enzymes means the cancer cell can't repair the DNA and it can't divide, and therefore the cell dies. Olaparib is given to anyone with a BRCA gene mutation who is HER2 negative, and you have it after chemotherapy and surgery. Are there new treatments for metastatic triple-negative breast cancer? Yes, there are. There are 3 new treatments that have become available, and it's really exciting to see what the future is going to hold. Your cancer will be tested to see if you overexpress a protein called PD-L1, and this protein helps your cancer cells hide from the immune system. Pembrolizumab, also known as Keytruda, and atezolizumab, also known as Tecentriq, both block the PD-L1 protein, and this helps your immune system find the cancer cells and destroy them. If you've already had 1 or 2 rounds of chemotherapy, including at least 1 for stage 4 disease, you will be offered Trodelvy. And this is made up of 2 drugs, one which attaches to a protein called TROP2 on triple-negative breast cancer cells, and the other which is a targeted chemotherapy drug, and together these destroy the cells. Now, I can't imagine how scary it might feel to be diagnosed with triple-negative breast cancer, but there is hope available with these new drugs that are being developed all the time to help women like you live for as long as possible. If you've got any other questions about triple-negative breast cancer, let me know in the comments. I'm Dr. Liz O'Riordan, and thanks for watching my channel.